My name's Michael. I'm a clinical psychologist. I work at the Royal North Shore Hospital in the pain centre. The way I noticed that there might be a problem is I had a lump on my throat. It was just like a gland swollen, and I thought I might be just getting a bug. I let it for a couple of weeks or so, and it didn't go down. So I went to my GP. He thought it the same thing, but he thought I will get an ultrasound. That was inconclusive, so then decided to get a biopsy, and that found the squamous cell cancer cells. The primary site of the cancer was in my tonsil, and there was a spread to my lymph gland in my neck. They started the radiotherapy, so that went on for 6 weeks, and as it goes along, gradually you start to get the side effects coming in because as they knock out your salivary gland on that side, then your mouth dries, and as your mouth dries, then you start to get these ulcers, and that becomes part of the management problem.
Mucositis often causes pain and discomfort when chewing and swallowing, and is a common side effect of cancer treatment. This pain on swallowing is the result of inflammation of the mucosa that lines the mouth and or the throat. It can be really difficult to eat when it hurts to swallow. Today we'll go over some strategies that may make eating a less painful experience. However, if your mouth is not improving, it is important to discuss with your team appropriate pain relief strategies.
The main barrier was pain when I ate, when I swallowed. The ulcers are very painful, and you prefer really not to eat or drink, but you actually you have to, because you've got to keep your weight up, you've got to keep the shape in your face. You start losing weight, losing say fat from your face, that alters the accuracy of the radiotherapy because it's very finely targeted. So you've got to maintain your appearance, and they weigh you every week to make sure.
When it is uncomfortable to chew and swallow, certain foods can feel more abrasive in the mouth, like toast or foods that are crumbed. Try softer foods that are easier to chew and swallow, such as warm porridge, French toast, soaked cereals, mashed vegetables, and minced meat dishes. Adding extra moisture to meals like sauces and gravies, or consuming liquids with meals can also help. This can help you to consume some extra calories, which keeps our dietitian colleagues happy.
The dietitians at the hospital, who I think are very good, they check you regularly and what you're eating, and they give you a lot of advice and so on. As I said, my wife's was pretty good about all that, and so we had 2 different meals that she would make the purees and things for me, and they would eat normally.
You may also find that certain foods sting a sore mouth and throat. Usually these foods are more acidic or spicy. Foods such as tomatoes, curries, pineapple, potato chips, citrus fruits, and alcohol can irritate a sore mouth. Foods that are either too hot or too cold can also be problematic. People find different foods soothing when they have a sore throat, so it is important to try different foods to see what is going to work for you. Foods people generally find more soothing include milk, yogurts, custards. Play around with the temperature of foods. For example, you may find that closer to room temperature is more comfortable for you.
I used this mouthwash, xylocaine. You just take really a teaspoonful, and mix it with a bit of water and swill it around my mouth just before I ate, and it would give me about 10 minutes where I could eat, and then the pain would come back, so I'd have to take some more. On the label it says it should last 20 minutes, but I never found that.
Poorly controlled pain will usually make the situation worse. It is important to be compliant with pain relief as best as possible, and be open with your team if the regime isn't working for you. If you are losing weight, refer to your gaining weight video, which has more details on how to add extra calories to your meals.
So I think that doing something about the pain is my recommendation, rather than just suffering it or putting up with it, particularly if it's interfering with something as vital as eating. The other problem with eating is, besides the pain, is it's tasteless, because my salivary glands are knocked out. Your mouth gets very dry.
Dry mouth is a condition that affects many people. Oral hygiene is very important when you have a dry mouth, as it can put you at more risk of developing oral thrush. Be sure to brush your teeth regularly, use mouthwash, and sip plenty of fluids.
The taste, though, it's like your taste buds are affected, and food tastes like cardboard. It's you just about can't taste anything, and yet you know you've got to eat. So it's a sort of it's a mind over matter sort of situation.
Commercial dry mouth products are available at the chemist or grocery store. However, about half of people with dry mouth continue to report that the best comfort is regular sips of water. Additionally, chewing sugar-free gum can also help to stimulate saliva production. Adding moisture to meals can also help. Adding extra oil, cream, or sauce to meals increases the moisture content of the meal, making it easier to chew and get down.
Well, I was told to sort of, buy a lot of ice cream because, the cold and so on. It was certainly something I stocked up on. I had to alter my diet to fit in with this. So I ate more ice cream than usual, yogurt, those sort of things. They were fine, but any solid things that required chewing, those were the ones I really couldn't do.
Consuming liquid before and after each mouthful of food can also help. If your food is sticking to the sides of your mouth, it can mean that there isn't enough moisture in your meal and you may need to add more. Some foods and liquids can dry the mouth out. Be mindful of foods and liquids like alcohol, lollies, bread, and biscuits. Sometimes during periods of dry mouth, the saliva can feel sticky. Carbonated beverages like sparkling water or dark grape juice can help to loosen up these secretions. Regular fluid intake is important to help thin your saliva and relieve dry mouth.